Good evening, everyone, and welcome. We're going to be talking with Dr. Udani today. She's our naturopathic doctor here at Justine Blainey Wellness Center, and she's going to be telling us a lot about herself, but also about what you could experience during some of her visits. So, thank you so much for being here with us, Dr. Udani, and we're just so blessed to have you.
I'm blessed to be part of this amazing team. Thank you.
Thank you. So, would you be willing to share how did you learn about natural healthcare in your family?
Right. So actually I learned it really young because my grandfather was more of a naturopathic doctor when I was growing up in Sri Lanka. So I remember watching him treat patients, giving them all these natural remedies, and just really finding that was really amazing and really cool. And when we came to Canada, and I just really wanted to be a doctor, I think he inspired me quite a lot. So I was on the path to become a medical doctor. So I was doing all my exams and
Mhm.
everything. And then so along that pathway, my mom actually turned into more natural therapies and naturopathic medicine for her health issues, and I saw how much it was helping her. And I really liked the philosophy behind naturopathic medicine, which is about promoting the healing energy within you and using nature to heal. So that really kind of sparked a passion in me to follow that journey too. So I really think it started with my watching my grandfather and then seeing my mom, and just kind of seeing how that helps them.
Yeah. So, what is your philosophy when it comes to health and healing in your practice and in your life?
I really, really honestly believe that health it can be achieved for anyone. Everyone can reach that healthy where they feel their best, where they're most energetic or happiest, most content self. And that is, holistic. So this is where we look at your physical health. We take care of your
Mhm.
body. We take care of your mental health. We take care of your spiritual health. We take care of your emotional health, and and also how do we connect all of those together, because it's really important to have a team around you to support you as well. So my philosophy is that, getting to know somebody and really figuring out how are all of these aspects of their health, like how can I support all of that to give them the best chance at achieving a healthy life and healthy lifestyle.
Wow. What a great philosophy and a great mission in life is helping others.
Mhm.
Um, there are different modalities that you use, and I was wondering what if you could describe some of them that you actually use in your practice, and how do you know which modality to use?
Absolutely. Those are great questions. So usually when you come in to see me, so it is if it's a naturopathic visit, or an acupuncture visit, it is about an hour long. So first we start off with a conversation about what are your main concerns, what's going on with your life, why are you here to see me, what's going on. So then
Mhm.
from there I can see really like what modalities are most beneficial for you. So it really does depend on you and what you come in with. So a lot of the modalities I use, for example, is I do like to use a lot of physical therapy, so natural acupuncture, cupping, sometimes deep tissue massage, things like that. Also, I like to use a lot of botanical medicine, herbal teas. I do like nutrition as well. So, giving you the foundations of diet help, diet support. You'll be surprised at how many people are not eating enough protein or drinking enough water. So, those basic things can really go a long way as well. So, and having someone there to kind of keep you accountable can really help too, and
Mhm.
guide you in a non-judgmental way to like how to adapt these to your busy life. So those are some of the modalities I do use, and I could see from your lifestyle or your just like from getting to know you as a person, which ones to use best.
Yeah, that's amazing. And you talked a little bit about acupuncture. Can you explain a little bit more about acupuncture and about using the sterile, non-reusable needles? And is it gentle?
Good question. Good questions. So, acupuncture is actually a very old traditional medicine. It's over 2,500 years old, and it's really, really very commonly practiced in Asia and China. There's actually hospitals just for acupuncture. So they only use acupuncture and traditional Chinese medicine herbs. So it's very, very widely used there, and it's gaining a lot of traction here too, because there's a lot of benefits on some conditions. I treat things like stress, things anxiety, fertility issues, digestive issues, weight issues. And the theory behind it is that if you're familiar with yin and yang, so our bodies have these two energies in us, and with acupuncture you can balance the energy. Disease only happens when these energies are off balance. So there are specific points in the body that I've been trained to look at to help correct these energies. And for most of my patients, the needles are just fine. I do a little massage to help them, and they're very, very, very tiny. So they're like actually like the width of your hair. They're very
Mm-hmm.
small. They're not like those big syringe, the blood injection syringes that we use. Nothing like that at all. And they're all sterile, so we only use it one time, and we safely discard them. So they're very hygienic, and I make sure that everything is your skin is cleansed with alcohol first to make sure that's good. And of course, I always check in with you to make sure, are you okay? Are you in pain? Is something hurting?
Mm-hmm.
So that way we can make sure that those needles are good. And to be honest, they're not that painful. Like I can needle myself without any issues. So
Yeah.
it's I think it's more of a mind over matter type thing.
It's so
Yeah.
relaxing, actually.
Yeah.
Very relaxing when you're laying there and, just letting them kind of do their thing.
Right, exactly. And I know you found benefit with it too. So
You
I'm
do.
happy.
It's
Yes.
been amazing. So, if we're thinking about somebody coming to visit for the first time, how long would that exam be? And what kind of information do you need? And why would you need it?
Yes. So if you're coming in, initial visit is about an hour long, and you might be surprised because when you go to a family doctor, it's like 5 to 10 minutes, right?
Mhm.
And it's usually like one issue, you get that, and then you try to figure that out. But when you come see me, I spend an hour because I look at everything, including your main concerns, your past medical history, any surgeries, hospitalizations, your diet, your lifestyle, your energy, your sleep, how much water you're drinking, like all of those things, because this is very unique, very individualized to you. So we're trying to figure out what is actually the root cause of your symptoms. And I can't find that out with just 5-10 minutes. I need to dig deep and figure out what's really going on behind the scenes and really get to know you as a person, and instead of just thinking of you as just a number where I can give you something that will be like a quick fix. We don't want that.
Mhm.
I want to make sure that your health you're healthy for a long time. You're not dependent on medications. So that's why a lot of naturopaths do end up having an hour-long visits to make sure that we really get to the nitty-gritty. And I even talk about your poop. Like I want to know
Yep.
everything.
Pretty transparent on that. But it
Right.
also sounds like there's also follow-up treatment. And what does that look like?
Absolutely.
How long was that?
So yes. So if it was more physical concern, follow-ups are, every week or every other week until we start to see improvements. So
Mhm.
this is where with acupuncture, I recommend coming in once a week for the treatment sessions. If it's more of a natural, like more a, let's say, digestive concern or issue with hormones, for example, a follow-up will be about half an hour visit, and it'll be about once a month per se,
Okay.
let's say. Okay,
Yeah.
so really, yeah, that will be the ranges.
That's amazing. And so, what sorts of recommendations or tests do you normally use to boost somebody's immune system?
Great question. So, I mean, that was a big thing, when we had the pandemic and we were trying to fight COVID, boosting your immune system. So, some of the tests I would regularly check would be a regular blood test. So, this is to see how is your red blood cells, how are your white blood cells doing? Are they fighting infections? Are they okay? Might also test for your vitamin D levels, your zinc levels,
Mm.
um, all of those. Like maybe do a mineral nutritional panel to see, do you have the enough vitamins and minerals you need to boost your immune system.
Mm. And what sort of recommendations or tests specific to somebody who is needing hormonal balance for menopausal symptoms or amenorrhea? Is it?
Amenorrhea.
Yeah, or severe menstrual cramps, because I know that you specialize in women's health.
Absolutely. So yeah, so there's a lot of women just really thinking that this is normal, having really bad pains or cramps, and it's not really normal. Like there's something going on, and you shouldn't be taking painkillers every month, or you shouldn't be feeling like you need to take a day off, because your cramps are that bad. Or you shouldn't really be missing your period for more than 28, 30 days. That's also not normal. And with menopause, you get those symptoms of hot flashes, mood swings, and also weight gain too. So how do we manage all of that, right? So there's different things as we as women go through every month, because we're amazing. And we also obviously do more things because we have the capacity. So in those conditions, what I would first check for is to see, how are your hormone levels? What's your baseline? Like, let's get a baseline to figure out, are you low in estrogen or progesterone or testosterone, or your DHEA? Those are some other comprehensive hormones. And if we can't find out exactly what's going on, I might even order more comprehensive tests, like a Dutch test. So that's more next level, I would say. So, and even women that come in with acne, for example, I know you have some questions on that. They might also benefit from hormonal testing. So we would do that. And to balance your hormones, we will be using a lot of diet and lifestyle, but also there's natural herbs, medicinal herbs and supplements that can we use to help as well. And I tend not to give too many supplements. Like in one go, I only give like 3 products at, because it can be overwhelming to also take so many different things.
It's probably also nice to engage what something's working first
Yeah,
before we start adding.
absolutely. Exactly. Exactly.
Mm-hmm.
Yes.
And I know you work a lot with digestive concerns.
Mhm.
So, are there some recommendations and tests that you typically use to assess those? And um, yeah, because I think there's so much, and I know you're looking at people's poop. You're pretty honest about your conversations with it.
Yeah.
So, let's talk about digestive.
Absolutely. So a lot of patients come in to see me with bloating, gas, constipation, or diarrhea, or food sensitivity. So like they'll eat something and they immediately feel bloated or like lethargic, for example. So when they come in with these issues, I look at trying to eliminate certain bacterial overgrowth. It could be parasitic, any kind of that could be causing all of these issues. Could also look at food sensitivities as well. So we might do an elimination diet just to see what's going on. And also really to and to figure out, is this like a physical issue or more of a chemical issue, or something to do with the food and the parasites and things like that. So I like to work with family medical doctors to see, can we do ultrasound, can we do colonoscopy, or if you do have already done those, you can bring those results to me so that we can look at connect the dots. Because I think that's something that's lacking in our healthcare system, is someone there to connect the dots in between different practitioners and things like that. So this is where I really like to kind of fill in the blanks. So with
Mhm.
digestive concerns, a lot of times it doesn't really get noticed until it gets really intense. Like you get heartburn
Mhm.
and polyps start to show up. So how can we balance it before that, is to be more proactive and figure out what's the root cause.
Wow. And when we think about skin conditions, and I know you specialize and you have your Instagram and great little videos and clips and hints. But what types of recommendations in your practice do you normally are typically recommending for people?
Right. So, my focus with skin really began because I had acne for over 13 years and I was able to holistically heal it. So, my social media is mostly geared towards that because I want to help, predominantly women feel back to normal again, get that clear skin. So a lot of times I do see acne in my practice, or eczema, or dry skin, all of those conditions. And one of the first things we want to see is there a food issue? Food sensitivities can cause a lot of these triggers too. So this is why I do like to spend time with you to figure out, what are you eating, breakfast, lunch, dinner. Really go into nitty gritty to see
Deep
what
dive.
deep dive, 100% deep dive. And then we look into nutrient deficiencies, because your skin is your biggest organ, so it needs minerals and vitamins to help it stay healthy. So we look at nutrient deficiencies, might do some lab work. Oftentimes I can figure it out from the diet, so I can let you know right away what you might be low in. And of course, there's internal things we can use, like gut and skin is very highly connected. So if there's a bacterial overgrowth, that can affect the skin. So there's a lot of that goes on as well.
Wow. It really sounds like everything is so personalized, which is incredible. So instead of being, viewed by your condition, which sometimes happens in the medical community, you're really being viewed holistically overall, because there's so much going on in our body and it's uniquely working together.
Absolutely, 100%. And because I was in that I was going to go to the medical pathway. I know how the different systems of the body works, the physiology, and with the naturopathic knowledge, I can connect the dots better, and I can kind of help you figure out what's really going on too.
Absolutely. So what is the perfect patient or condition that you love to help and see great results with?
To be honest, if you want to improve your health, then you're the perfect patient for me. It's like, I have no really and no set rules that you need to be the A, O, B, or C. I am happy to help you to be on this journey of improving your health, because that can be so rewarding for you long term. And I love to, as you've been telling Angela, I love to talk about conditions of digestion, hormonal, women's health, mental health, and also skin issues, and of course joint pain, chronic pain. I love doing physical therapy as well. So those are some of the concerns I really do like to work with. But if you have something that is out of that, you can still come and see me for a meet and greet, and I can see if I can refer you to a colleague of mine that might be more specialized in that condition that you might be needing help with.
And so what would you want all of your patients, or maybe even future patients, to know about you?
Oh, that's a good one. I would say I'm so grateful to have known all of the patients that I have seen from Justine Blainey Center, and the future patients that I'm going to be able to see as well. I would say just, if you are ever kind of needing that additional support, know that I'm always on your side, and I'm always here, and you can contact me and get to, even if it's just a quick question, you can always reach me. Basically, I want to be as available as possible for you to kind of go through this health journey.
That's amazing. You know what? I wanted to thank you so much for sharing the wealth of knowledge that you have and your passion for helping people be the most optimal that they can in healthcare. Thank you for spending your time with us today, and we really appreciate it.
Thank you so much. And thank you for organizing all of this. I love doing the weekly webinars, helping informing our patients. Thank you.
So everyone, have a lovely evening, and we will see you all next week.